All right. So this is about psychological intervention. There's a mistake in the title. Should be on intervention. This is the slide. This is a correct slide. Okay. So we talked about how psychological distress can be a precipitating factor towards ED. So we want to find in which aspects do we help in to help them rather than getting them to avoid or distract or do find wrong treatment and stuff. And this can sustain the ED and have an effect on their relationships as well. So there are a lot of treatments, psychological treatments available, which are evidence-based. Some of them is cognitive behavioral therapy, one of it, which deals with how the mind functions and how perception of the cognition affects their behavior and affect the emotions of those involved. Yeah. Okay. There's also evidence on psychoeducation, of course, where we educate them about how their mind works and how their emotions are also related to their behavior and the physiological self. There's also interpersonal therapy, which involves understanding about how role disputes, adjustments with work life or conflict and grief, something to do with interpersonal can actually affect their behavior, their emotions, and we need to help them solve them as well. Mindfulness has also been found helpful. Sex therapy and marital therapy. Sex therapy involves more of sensate focus, touch, helping them to be able to be comfortable and finding out which part needs help. And we'll give them tasks and homework to do at home and then come back and report on it. Marital therapy is more about emotions, conflict resolution, talking about what are the things that they are both attracted to each other, going back to the old times and having them to hold hands right after therapy is really nice to see. When we become the neutral intermediator between the couple who have had a lot of conflicts, maybe for a number of years. So we become the mediator between those. And then sometimes we make some short personality tests in order for them to understand and accept each other's limitations and vulnerabilities. And then internet mobile-based intervention have also been found to be effective, as well as group therapy and counseling. They can be done individually, and it's based on their needs and also their difficulties. But a combination of a few, which is called eclectic and integrative therapy, have also been found to be helpful. Okay, next, please. So evidence from reviews found that a reduction in persistent ED are seen in focused sex group therapy, more effective than control group. And with sildenafil, it's better than medication alone. So group therapy and sildenafil has been found to be better. However, there's no significant difference in effectiveness between psychosocial intervention alone or a local injection vacuum devices alone. So there needs to be more evidence in this. The evidence are there, but low quality. Next, please. And then there's meta-analysis and systematic reviews, which have shown that combined treatment is better than alone. PDE5I inhibitors and psychological intervention had superior effects on ED symptoms than the treatment alone. So this effectiveness of combined treatment remains consistent regardless of the level of intensity in the psychological intervention. So we saw that in the treatment with our patients, with the medication it helps, but without the understanding and intervention of their issues, which are very tailored from individual to individuals, then when we have resolved their issues, when they're able to accept and find a way to solve them, to accept and solve them, it complements very much the medication which works best when there are less issues, when there are no issues, when so it's more effective, I feel, in my experience, in the long run, when we actually address those issues. So group psychotherapy was superior to wait lists as well. And non-pharmacological intervention rarely report any adverse effects or risks. As a recommendation, an integrated and collaborative approach with psychological interventions should be considered in treatment of ED. And lastly, psychological interventions, when properly applied, combined, and tailored, will significantly enhance outcome. And multidisciplinary collaboration is the key. So we want to treat the person and not just the symptoms. Thank you.